Now we have pancreatitis, bowel obstruction, appendicitis, board-like abdomen, GI bleed. You already know board-like abdomen, GI bleed. You probably don't know pancreatitis as well as you should. It is one of the deadliest conditions on earth. When we look at pain levels and we try to identify which condition is the most painful on earth, we have two conditions. Pancreatitis is one of them. Sickle cell crisis is the other. The pain with these two conditions are considered to be the most painful on earth. Now, we are dealing with pancreatitis, and I teach you to say it completely different. I teach everybody in this class to say this. Pancreatitis. Why? Did I hear it in there somewhere?
Because of the pain it's causing some of the breathing.
Why do I teach you to just say this on the test? Pancreatitis. Yes! Treat the pain first. That is your first nursing action. And guess what? Treating pain first is never the first nursing action unless it's pancreatitis. That's the only condition that you treat the pain first before you do anything else. Now you got to ask yourself, well, why is it with that? Here's our problem. You remember this? You remember where the pancreas is? The head is here, it's over, the tail is over here, it's all up in here. Here's the problem if you know what you're doing here with your hands. This pain right here, where this pancreas is so outrageous and severe that you can't do this. You can't even breathe in. When you go like this, you want to die. It's so excruciating. In fact, because you can't do this, you now do this. You're barely breathing. So because you're barely breathing, the fluid that is coming off of this pancreas inflammatory process, remember that capillary permeability, which said that fluid is going to leak out and all this stuff is going to be leaking out with it. And in the case of pancreatitis, all the infectious stuff leaks out. This fluid is going to get real bad, and it's going to rise up and it's going to fill your lungs and give you ARDS because you're not doing this. We do about every 9 to 12 breaths. You ain't did it at all. So you're barely clearing your lungs. Don't forget, when we finish doing surgery with you, we always teach you to do what? Cough and deep breathe. It's no different when pancreatitis. You've got to get this patient's pain under control so they can deep breathe and keep this fluid out their lungs. Same thing with the OR. Okay, so this first nursing action, let's see how you do. So your test is mean, a little bit of hateful. It has on here, your patient comes in with pancreatitis, full-blown pancreatitis. They're rating their pain a 10 out of 10. It says, what is the first nursing action? Start IV, give 8 milligrams morphine tablet, make patient NPO, offer the patient 25 milligrams of WPO. Okay, which one would you like? Pick 1, 2, 3, or 4, not the word, just the number. What would you like?
2.
What would you like?
2.
What would you like?
Well, we should give one. We just
First nursing action, 1, 2, 3, or 4.
2.
2.
I can't see where. 2.
2, I guess.
I'm about to say, I kind of want to say one.
What does 4 say again?
Oh, 25 milligrams of WPO. I can't hear you. 3, okay. Now, here's our problem.
Is it 1? I think it's 1. Because the tab's gonna take too long. The IV is gonna be quicker too to get the pain through them.
I just told you this was the worst pain on earth.
So it's gonna take too long with that tablet.
This is going to be PO. They are supposed to be NPO.
Right.
Everything they eat will make this worse. Even pills. These pills will nowhere near come close to touching their pain because their pain is so severe they need IV push meds
That's
only.
what I was thinking after the fact. I was like, but I was just listening to other people, but I'm like, they don't think it is.
Ain't it crazy?
Yeah.
But that's how your test is.
Yeah.
This is very common. This question,
I had
very
one similar
common.
to something like this, and I was like, but it didn't true because I was like, you got to do the IV first, because
Gotta do the
IV
IV.
gonna get to you quick.
See, they know that you learned the first nursing action is treat the pain, so you shot right to pain. Yeah, it's really, you just gotta take your time. If it looks too easy, it probably isn't the answer.
Exactly.
Okay? It's just like, what is going on? Now, quiet but deadly, what did you say? She said, she got it right. Quiet but deadly got it right. I told y'all, you better watch her. She ain't right, honey. Okay, y'all, so that's pancreatitis. Now, remember that pancreatitis is deadly. What is the number 1 cause? Cause or complication? Alcohol. Yes. The number 1 cause, once again, is alcohol. Y'all better stop what you're doing. You're doing too much. Okay, so you got it. Bowel obstruction. This is, as you know, absent bowel sounds, right? But that isn't what's on the test. What is on the test is what is your first nursing action with a suspected bowel obstruction. And what would you do first? Okay, what you gonna do first? IV, what are you gonna do first? Thank you, I ain't even gotta keep going. Thank you, darling. NPO is first, because here's what you don't want with your little bowel obstruction patient, and I have seen it because the nurse is stupid. Here we go. I had an aide that told me in this class that she told the nurse that the patient was throwing up poop. Now, the most common patient that gets a bowel obstruction has it in the form of this fancy $4 word. Make sure you know it. Oh, I got the wrong marker here. This is typically what the post-op patient has. And you needed to remember that bowel sounds do not have to be active until 6 hours post-op. So don't let them fool you. If you see somebody 2 hours post-op and they got absent bowel sounds, so from the what? It's not until about 6 hours post-op that you even have to worry about it. But you got to worry about it. So now you're going in, you're doing your assessment, you're listening to bowel sounds. You cannot say they're absent unless you listen to all 4 quadrants for 5 minutes each. Ain't that right? Okay, so now you done said this patient, the aide done came out and told the nurse the patient's throwing up poop. Nobody is throwing up poop because poop comes from fucking rectum and you can't throw up from that far. What did I teach you? It comes from the stomach. Throw up comes from the stomach, not anywhere else. So now we have to look and see what happened to this man. I know exactly what happened to this man because I've seen people do it. The first thing is you went in there and you really wasn't no nurse that gave a damn, so you really ain't even listening to no bowel sounds. How you feeling? You feeling all right? Okay. Now, so he gonna get his breakfast tray because he feeling all right. Now, he gets the breakfast tray. Let's just say that his obstruction is right like that in his colon. Are you with me? Okay. He just ate breakfast. It ain't going nowhere. So it makes the obstruction worse. Are you with me?
Yes.
Same trifling nurse, working 12-hour shifts. How you feeling, Mr. So-and-so? I'm all right, I guess. I don't really feel that good. Must have been something I ate. My stomach hurt. I feel like I gotta go to the bathroom. Oh, okay, I'm gonna get the aid. Trifling ass. Now, he done had his lunch tray. Here go lunch. His bowel obstruction when you came in at 7 was mild. Had you bothered to listen, you would have had absent bowel sounds low and hyperactive high. This would have been loud. This would have been low or absent. But you don't give a damn. So you just did a verbal and kept it walking. And now he done ate his breakfast and made a bowel obstruction worse. Because it's going to get real inflamed in a minute. And all of this going to be air and water because it can't get through. His belly's going to be distended. Here you come because you got a clue. You came from Shelley Nursing Review. You walked in at 7 p.m. You got report from this bimbette. You asked this bimbo. You said to her when she said he had surgery yesterday, he ain't feeling all that great, but he's all right, tolerating PO, all this bullshit. You said to her, oh, okay, he ain't feeling that well. Is he passing gas? She never asked him that. Remember that? Remember, she never asked him. That was the first problem. Because one of the ways you know this is moving is you pass gas because air can get through. You didn't pass gas. This is a red flag, people. Now, he already told you wasn't feeling that great. I'm sure it got worse as the day went on. Remember, this man is on narcotics, so any opioid is going to cause constipation anyway. Remember that they probably didn't serve him a big old meal after post-op, so this is his first opportunity to really eat. He's eating a lot, okay? So all this is going on, and you take report from this woman. You're concerned because he's post-op, and she said he wasn't feeling that well. You go in that room, and now his belly is big. Because by now it is big. And you know instinctively to listen to the bowel sounds, and you ain't getting shit. Here's our problem with that. Because you had a bimbo earlier in the shift, and she let that man eat that breakfast and that lunch, instead of keeping him NPO, this has rotted out. that part right there has rotted out, became ischemic, needs to have a bowel resection and a colostomy bag. Most likely for a long time because of you, the nurse. Had you listened to the bowel sounds, had you asked this man if he was passing gas, and it was just a simple obstruction, just a little potassium would get that muscle moving again, because potassium controls GI muscles. And that's all he really needed, because everybody after having surgery is usually low in their potassium. That's why you hang a lot of KCl on post-op units. You give a lot of KCl, potassium chloride, because their little bowels and everything need it. They lost blood. What was inside every blood cell? Potassium. They lost blood in surgery. They lost potassium. It's not hard. Okay? So that's what you get. Paralytic ileus. Okay. Now, the next one, appendicitis, we went through that, been there, done that, t-shirt, sun visor. What I would say about all of these pancreatitis, bowel obstruction, appendicitis, keep the patient sitting up, knees to chest. No matter if it's pancreatitis, bowel obstruction, appendicitis, keep the patient sitting up so this fluid doesn't go to their lungs, and bend their knees to chest. Knees to chest feels better because it puts pressure on the belly and it feels better. Remember this term with your appendicitis. Remember the term rebound tenderness. And with appendicitis, I want you to remember pain at McBurney's point. Pain at McBurney's point. Now, let's do the rebound tenderness first, okay? So, you come in and I'm doing an abdominal assessment and I say, does it hurt here? No. Does it hurt here? No. Does it hurt here? Little bit. Now, when you're palpating, rebound tenderness is this. When you press, it doesn't hurt. When you take your fingers off, they're screaming. That's why the whole knee to the chest feels better, because it's almost like you're pressing it so it doesn't hurt. That's why when people are in severe abdominal pain, they hold their bellies like this, like, oh, it feels better. Okay, now we have a Jay-Z rhyme for the pancreatitis, for the appendicitis, for the bowel obstruction. For all these GI emergencies, we have a Jay-Z rhyme. Here it is. Without exception. Oh, and McBurney's point is right lower quadrant. McBurney's point is right lower quadrant. Without exception, all of those GI emergencies that I just gave you is this. IV, NG, Foley, surgery, type and cross, lights, type and cross, and electrolytes. Okay, so let's look at this. IV, NG, Foley, surgery, type and cross, and electrolyte replacement. Every GI emergency, it's that simple. So with the patient, with the GI emergency, it's IV times 2, generally it's going to be 18 gauge. With the NG, automatically they're NPO and they're NG if they're vomiting, automatically. So if it's not an NG, it's damn sure NPO. but that didn't go with my rhyme. The Foley may be done, the catheter, because we don't want to hit the bladder during surgery. So we prepare for surgery by putting that little Foley in there. And then surgery if we had to do it. Appendicitis, of course we have to do it. Type and cross because many of these GI emergencies can bleed. So let's figure out what her blood type is. And then the biggest one you got to remember is electrolyte replacement. Every one of these abdominal people are going to have a low K. Most of them are going to have a low K because that bodily fluid is you're losing it. You're going to have a low K. Especially if you're vomiting, diarrhea, whatever you're doing. Low K. Okay, so NV and D, low K. What's NV and D? Let me not assume. Nausea, vomiting, diarrhea. Right. Okay, babies. We already did compartment syndrome. We already did the consent form. And then we have something else for the babies. What does it say? EKGs. Pull it out. Now, I mentioned to you